Thank you very much, Mayor. Our coronavirus case counts this week are similar to what they were before, which means we need to be careful. So here are the numbers. Since this time yesterday, we have identified 258 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing our total confirmed case count to 114,176 people since the beginning of the epidemic. And in addition, there are 54 probable cases diagnosed by the rapid antigen test. Now, for the past week that ended on February 27th, we averaged 241 cases per day. That's both for the PCR and the antigen test combined. That's so far. We expect additional cases to come in later. And of those people tested, 3.5% of people tested positive. Now, for the previous week that ended on February 20th, we averaged 242 cases per day, and 4.0% of the tests were positive. So I'm concerned that the previous decline that we've been seeing may be stalling. In part, that's just by looking at these numbers. In part, it's also because I'm seeing that case counts have been rising in the past week in New York and New Jersey and Delaware. As far as deaths goes, we have 11 new identified deaths, bringing us to the total of 3,102 since the beginning of the epidemic. We've had about 40 to 50 deaths from the coronavirus infection in the week of per week in February. That's down from greater than 100 deaths per week in December. Now let me talk about where we are with vaccination. In general, the supply of vaccine doses is growing. I don't yet have the numbers of the allocations we have this week for delivery next week. Last week, we had the numbers that were going to be delivered this week. Just to repeat those numbers, last week we were allocated 16,380 doses of Pfizer, 15,600 doses of Moderna vaccine, and then there were an additional 5,000 or so doses of Moderna vaccine sent directly to pharmacy chains by the federal government, bringing us a total of about 37,000 doses that were allocated last week and that will be delivered to providers in the city this week. What's new, though, is that this week we will be allocated doses of the Johnson & Johnson vaccine. That's the new vaccine that was just newly approved by the FDA this past weekend. 13,000 doses is what we can expect to get, and that will be ordered by us now and will be shipped to providers later this week. More about that in a minute. And how are we doing as far as administering vaccines in the city? Well, as of Monday midnight, we have reports of 210,000 people in the city who have gotten their first dose of vaccine and 102,000 people who've had their second dose of vaccine. So some pretty big milestones there. 200,000 with the first dose and 100,000 people gotten their second dose. Of those people who got their first dose of vaccine, 22% were African American, 4.3% were Hispanic, and 6.4% were Asian. So we're getting more diverse, but we still have a long ways to go to really achieve racial equity in our vaccine distribution. For the week ending February 21st, we delivered 40,659 doses of vaccine. That's the week before last. And that's first doses and second doses combined. It's a measure of overall how well we're doing in it, getting the vaccine out to people. Now that 40,600 number is decreased from the 49,773 the week before. And we think that's likely because during that week is when we had 2 snow days that made it very difficult for people to get to work, and many clinics were shut down. Now for last week, the week that ended on February 28th, our data is incomplete, but so far we know of already 48,000 people who were vaccinated. So I think it's likely that we'll be at a new high for doses that were delivered per week. And I'm hopeful that we'll be more than 50,000 doses last week when all the totals come in. That's what's happening in the community as a whole. As far as our nursing homes, personal care homes, and assisted living facilities, we're making a lot of progress. They're getting close to having these people protected. Of the 102 of these facilities, which we set out to have vaccinated by the pharmacy arrangement that we have set up, 95 have been visited once, 82 have been visited twice, and 38 have been visited 3 times. And they've delivered 13,800 doses to residents and 11,700 doses to staff. Now, back in the community as a whole, we're still in phase 1B, and we're likely to be in phase 1B until late April. That means that the people who are eligible right now for vaccination are frontline essential workers, people over the age of 75, and people under the age of 75 who have high-risk medical conditions. Now, let me talk a little bit about the new vaccine, the Johnson & Johnson vaccine. This vaccine has a huge advantage that it can be given in a single dose. You don't need to have 2 doses of it. Unfortunately, we're only getting 13,000 doses right now. That's relatively small compared to how many other doses we have of other vaccines. and it is tiny compared to the number of people out there who want to be vaccinated. And we've been told that we should not expect to get more doses for about 3 weeks. So this is how much we're going to have at first. It's a very small number. In view of that small number that's available to us, and in view of the advantages of this vaccine, we are recommending to providers who receive the vaccine, excuse me, that they should set a priority for receiving that vaccine on people who are difficult to reach, so they don't have to reach those difficult to reach people twice. So that would include homebound people, would include people who have limited mobility, would include transient people. But it'll be up to the providers to figure out who are those people that are in fact difficult to reach. We'll be giving this vaccine to hospitals and to community providers to try to reach those people. Now, in general, how is the vaccine being made available? We're now up to 128 different enrolled provider sites. One provider may have multiple sites, but 128 enrolled provider sites. That includes hospitals, it includes clinics, it includes pharmacies, Rite Aid, Walgreens, ShopRite, Walmart, Acme, Sam's Club. They all have vaccine now. And an increasing number of independent pharmacies. We now have 11 independent pharmacies that are enrolled as providers, 8 of whom are receiving vaccine this week, and then the rest will be receiving their first batch of vaccine next week. We've talked before about the mass clinics, or the community-run large clinics, I guess I should call them now, in Philadelphia's neighborhoods that are managed by my department, the Department of Public Health. Today, we're going to be at a site at Drexel University in West Philly. Thursday, we're going to be back at the Martin Luther King Older Adult Center in North Philly. And on Saturday, we're going to be at the Community Academy of Philadelphia Charter School again in Juniata Park. And again, these are not walk-in sites. These are not sites where people can just call up for an appointment. People who come to these sites are people who have been invited from our vaccine interest database on their website who meet the Phase 1B criteria. In addition, the Black Doctors COVID Consortium is continuing their vaccination sites. They are doing walk-in clinics. The schedule was reported in the newspaper today. I don't have it with you, but that's the first organization that's trying walk-in clinics. And then, as the mayor said, launching tomorrow will be our Center City Vaccination Center at the Convention Center. That'll be available, open tomorrow for people who are eligible under Phase 1B. That includes both frontline essential workers and people who are eligible based upon their age or medical conditions. As the mayor said, it's staffed by federal staff. It's mostly Marines and Navy corpsmen. The vaccine that is being used has been provided separately by the federal government. It doesn't come out of our allocation, and it's Pfizer vaccine. And the city's responsibility is that we have established the protocols under which they're working. We are providing physicians there. We're providing extensive logistical support. We're doing the scheduling of people there, and we're managing the data. Now, yesterday and today were a soft launch of this clinic to test the workflow. Yesterday, yesterday and today we're vaccinating frontline essential workers, people who have worked at the convention center, maybe working at the site, some city workers who have meet the definition of frontline essential workers, and SEPTA workers. Yesterday, in 2 hours, in a test of this, they vaccinated 824 people. So we think, based on that we can get up to the 500 people per hour, which gets us to the 6,000 people per day if they operate 12 hours per day tomorrow. Now, the people who are eligible for going there are people from our vaccine interest database. And that includes people over the age of 75, people with high-risk medical conditions, and frontline essential workers. We are inviting people who are in that database, and we're oversampling as we pull data from that database from the zip codes where we've had fewer vaccines delivered so far. Most people are going to be invited by email. Some people will be invited by phone call, particularly people who are in groups with have limited English proficiency. Most important thing for people to know is this is by invitation only, no walk-ups. Please don't just come to the convention center and hope to be vaccinated. It's by invitation only. And the invitation should come directly from the health department. If you got a link from a friend or from the internet, you are not invited. Please don't schedule an appointment. Please don't try to jump the line. If you want to be vaccinated there, put your information into vaccine interest, and if you're eligible, you'll get an invitation. That's what we're doing in that center. Now, at the same time, the Children's Hospital of Philadelphia is vaccinating teachers and support staff and childcare staff. This week, they're expanding from the one site they had last week to 6 school sites in addition to that. So far, there are 16,000 people who meet this definition that have scheduled appointments. So that's moving along quite well. Then we've put out plans before about how we're distributing vaccine, and many people don't understand the system for it. It is complicated. We have published a plan for that back in mid-January when much was unknown. But as of tomorrow, we'll be publishing an update on that plan that lays out more about the progress we've made to date and how we expect the next couple of months to play out as far as vaccine availability. So what should people do who want to have this vaccine? First, you may be invited by hospitals, by clinics, or by your employer. But if you want to register your interest in getting vaccinated, just go to www.phila.gov/vaccineinterest, one word, and put in your information. And as opportunities become available, we will contact you. If you don't have access to the internet, call 311 and someone will assist you in putting your name in the database. At the moment, there are now 254,000 people in the database that are waiting for vaccine. I'm glad that so many people in the city want to be vaccinated. That's not everybody who has signed up. There's an additional 26,000 people who signed up whose names are now removed because we now know that they've been vaccinated. And just remind people that we also have an opportunity for organizations that have essential workers to want to have them sign up their interest noted by us as an organization. The link for that is www.phila.gov/businessvaccine. It's for any organization, nonprofit or for-profit, any employer, any size. Let us know about your organization, and as opportunities come up, we will notify you. I'll move now to our safer at home restrictions. As you know, last week we relaxed some of the restrictions that we put in place during the peak of the epidemic last winter. In general, we became more consistent with the state of Pennsylvania. Yesterday, the governor allowed an increased capacity at events, particularly large events, and the capacity limits are easier to understand. They're 15% capacity indoors and 20% capacity outdoors. So we will be changing our restrictions as well to be consistent with the governor's plans. This affects in particular the very large venues, in particular the sports stadiums. So we're working now with the sports stadiums on the details of their safety plans, but we will be consistent with the governor's new standards for those restrictions. Having said that, let me put out a warning there. The increasing number of cases in the region are absolutely a reason to be concerned. This epidemic isn't finished yet. It's surprised us in the past, and it likely will again. We have not vaccinated enough people yet for the entire community to be protected against this epidemic. Everyone should continue to take coronavirus very seriously. What that means is wear your mask whenever and everyone, keep your distance, even if you're vaccinated, and no indoor gatherings. It's the indoor gatherings where people are not wearing masks, particularly when they're with friends and family, that are the highest risk situations. If you do want to get together with others, do it outside with masks. All of our information is at our website, www.phila.gov/COVID. Thanks.
My question is for Dr. Farley. Can you give us an idea when the teams will be allowed to have fans in the stadiums?
Yeah, it's effective immediately.
Okay. And for Mayor Kenny, has there been any talks about doing another mass vaccination site, especially maybe considering Lincoln Financial Field?
It's certainly under consideration. We're waiting to see how many more vaccines will be available, and when the weather changes kind of to a warmer climate for the longer term would probably be the appropriate time to talk about it.
And final one for me for Dr. Farley. Can you give us some of the discussions you had with the teams when the governor announced yesterday the change to the crowd limit?
Yeah, we had meetings with representatives of both the Wells Fargo Center and Citizens Bank Park, and we talked about their protocols that they had sent us about how to avoid crowds, how to enforce mask use, how people are grouped in pods so that they are not mixing with each other. And so those are the nature of discussions and really the details that would try to make this as safe as possible.
All right, thank you.
Thank you, David. Let's go to Charlene Santiago of Univision.
Hola, buenos días.
Buenos días.
Bien. Mi primera pregunta es sobre el centro del 311. Sé que la ciudad estaba contratando a personal bilingüe en español. ¿Cuál es el estatus y cuentan actualmente con personas bilingües que ayuden de inmediato con el tema de la vacuna?
Esta pregunta es para el alcalde o para el Dr. Farley, idealmente. ¿A quién se la diriges?
Sí, para el Dr. Farley.
Dr. Farley, this question has to deal with access to information for registration to vaccination through the 311 call center. I had understood that they were hiring people, bilingual personnel, especially those that handle Spanish, to help with the registration. And I'm wondering how many bilingual agents are there providing the service at this time?
I don't have the numbers for that. We do have the ability, we have people who speak Spanish. I don't have the numbers of people who can do that. I don't know if Tumar Alexander has any numbers on that.
Tumar?
No.
Yeah, good afternoon. I'm not sure if you guys can see me on video. Armando, we will get those exact numbers. I know that hiring process has started. I'm not sure it's completed yet, but we are using the staff already as that's assigned to 311 who are bilingual to help out with this process until we bring on more staff, and also utilizing the language access line as well.
Lo que nos dice tanto el comisionado Farley como el señor Tumar Alexander es que no contamos en estos momentos con los números exactos de los agentes que están atendiendo a las necesidades de las personas bilingües, específicamente a las que hablan español, pero que el proceso para contratar agentes está activo y no se ha completado todavía. Y mientras tanto, el personal bilingüe que tienen disponible está manejando estas necesidades y también hay el acceso a la línea de apoyo que se puede hacer informalmente. Gracias.
Línea de apoyo en español.
Language access line. Tumar, the language access line would cover not just Spanish needs, but many other languages, correct?
Yes, sir, Armando. That's correct, sir.
Eso es correcto. La línea de apoyo nos cubre en muchísimos idiomas, no solamente el español.
Segunda pregunta es sobre el centro de FEMA. A pesar que puede ser, ¿verdad?, de gran conveniencia para muchos, quiero saber qué tiene que decir alguien en la ciudad sobre, ¿verdad?, alguna inquietud que algunos residentes puedan tener con el tema de estatus migratorio, qué información se pide a la hora de la registración solamente para address, ¿no?, esa inquietud que quizás algunos pueden tener.
Correcto. ¿Te refieres tú a la vacunación que se va a dar en el centro de convenciones, correcto?
Correcto, sí. Gracias, Armando. Sí.
Cómo no. Gracias, Charlene. The question, and I don't know if Mayor or Dr. Farley would like to address it, is just to provide reassurance to citizens of the city and residents that might want to register for vaccination at the convention center in terms of being requested information about their migration status or any other sort of identifying information.
That is not a required information. You don't have to show resident status or any status as far as your citizenship or immigration condition is.
If I could just specify that further. So yeah, we're not going to collect any information about immigration status. People do need to be Philadelphia residents, but their proof of residency could be a bill, a letter, anything that indicates that you live at a certain address. Doesn't have anything to do with your immigration status, and there will be no enforcement by ICE or any other immigration agencies anywhere near the convention center.
And Secretary Mayorkas made that very clear today in his presentation. There'll be no activity by ICE near the center.
Bien, lo que nos dicen, Charlene, es que primero, para poder acceder a esta vacuna, no es un requisito demostrar o comprobar ningún estatus migratorio ni pruebas de residencia legal en el país. No se va a pedir información ni se va a recolectar esta información. Sencillamente se les va a pedir que sí comprueben que son residentes en la ciudad de Filadelfia. Y esto se puede comprobar a través de una cuenta, una carta o una dirección que muestre la ciudad. También nos indica tanto el alcalde como el comisionado Farley de que las agencias de inmigración, específicamente ICE, no van a estar presentes, y esto lo ha recargado el secretario Mayorkas en su discurso anterior, que no va a haber ninguna actividad de ICE en conexión con el proceso de vacunación en el centro de convenciones. Gracias.
Super. Es todo por mi parte. Gracias, Armando.
De nada. Thank you, that's all.
Thank you, Charlene. Let's go now to David Merrill of Philadelphia Magazine.
Hi, first question is about the vaccine interest form. I guess it might be for Dr. Farley or Tumar, but I've been hearing that people who sign up on the interest form more recently have been receiving confirmation emails from the city, whereas folks who signed up much earlier did not receive any kind of email confirmation, which is sort of creating some amount of confusion among people who did not receive a email confirmation from the vaccine interest form. So wondering, if what happens for people who never did receive a email confirmation? Is there a way to confirm that you are on the list, or will the city be sending email confirmations for those people who signed up earlier that never got one?
Correct. So a few days ago, we started sending confirmation emails after people initially registered, just to let them know that we have them in the database. But we are, for people who are not getting invitation, we are periodically sending out emails that simply say, we have you in our database, and we will invite you when the opportunity arises.
So speaking for myself here, I think I signed up a while ago and have never received an email. So would it be bad to sign up a second time on the form if you haven't received any correspondence, or are you advising against that?
Everyone should feel free to sign up a second time if they want to. We know that there are many duplicates in there, and we can collapse those duplicates, so that's not a problem. Okay.
Second question is about the single-use link issues that we were talking about with respect to the FEMA clinic. I'm just wondering, first of all, who's handling that technology as far as trying to create single-use link problems, whether it's FEMA or the city? And sort of as a second part of the question, can you explain why this wasn't fixed or implemented beforehand, seeing as I think this was sort of a known problem, with at least the PFC clinics, but possibly others as well?
Yeah, so the software we're using for scheduling is called PrepMod. This is software that CDC recommended for states and localities to use. It's being used across the country. It's new software, and it's got its limitations to it. And so we identified early on that this was a problem, that if you invite an individual person to schedule an appointment, that a person could forward that link to someone else, and that other person could be able to schedule an appointment. So we have requested that be solved so that there would be links that are not forwardable. We were told that we were going to have a solution last week. It didn't arrive last week. We were told we're going to have it late yesterday. Haven't seen it yet, but we hope to have it today. So we're aware of the problem. We're doing the best we can to discourage people from forwarding links. And when we can identify people who have signed up inappropriately, canceling those appointments. But we're asked for people to please only do this if you got the email directed to you, and please do not forward these to other people until we can solve this problem.
And that's exactly the reason why we've done 2 soft openings, one yesterday, one today, to identify these glitches. But the bottom line is you're either going to be an honest person or you're not. We can't policy-wise or legislate honesty and unselfishness. And people, are going to have to. This is a crisis the size of World War II. I know folks back in those days did do the things that need to be done to win the war. And we're going to have to sacrifice and do these things to win this war. And I have really no sympathy for anybody who gets shown the door by the Marines in the next few weeks.
Final question is about the sort of the walk-up testing or the walk-up vaccination model as opposed to the invite model. I'm wondering, given that you said there are about 256,000 people, on the interest form currently, a large number, but still ultimately a relatively small fraction of the city's adult population as a whole. I'm curious, now that the Black doctors have done a walk-up clinic, do you have any idea about how many of the people they vaccinated in that 24-hour clinic were already on the city's interest form? I mean, was there significant overlap, or was it clear that the walk-up clinic was reaching people, who you did not currently know were interested?
We haven't done that data match. I expect that it did reach some different people. There's look at it either way. There's a huge demand for vaccination out there, and there's only so much capacity we have to deliver vaccines. And so any opportunity you have for vaccination is going to be oversubscribed. That's why we have people, forwarding links and showing up inappropriately. We have long lines when walk-up access is available. We're just going to have to deal with that until we get past that big demand. Eventually, the supply will catch up with demand, and then we'll be able to have walk-up access elsewhere.
And really quick, do you have any idea, statistics, or kind of a numerical sense of what percentage of the 256,000 people on the vaccine interest form currently are actually currently eligible under 1A or 1B?
I don't have that with you. We may be able to get that back to you, but I don't have it on my head.
Okay. David, if you could email the press account, we'll see if we have that for you. Let's move on now to Yaima Crespo of Telemundo.
Hola, buenas tardes. Mi pregunta es, siguiendo un poco lo que dijo la persona anterior, esta pregunta es para Dr. Farley con respecto a estos links que se compartieron. ¿Cómo está combatiendo esto para que no ocurra?
The question is a follow-up for the question that was asked just prior, Dr. Farley. In this matter of the links that were being shared, what can you tell us for the Spanish-speaking audience in that same regard?
So we are working on fixing the software so that invitation links could not be shared. But in the meantime, no one should share an invitation link with anyone else. And if you get an invitation link from a friend or from the internet, please do not sign up for an appointment. You're not invited.
Vamos a reiterar para la audiencia hispana de que estamos trabajando para resolver este problema. Este problema es que el proceso de registración incluye enlaces que pueden ser transferidos o forwarded a otras personas. Y si usted ha recibido uno de ellos, por favor, les pedimos que no se registren, por favor. No debieran compartirlo tampoco o recibirlo de ningún amigo o desde la internet. Muchas gracias.
Y esta pregunta, mi última pregunta también es para el doctor Farley, es sobre por qué están viendo un aumento de casos de COVID en la región.
This question is also for Dr. Farley, and is why do you think we're seeing an increase of cases of COVID in the region?
It's not clear. We don't think we've vaccinated enough people to make the epidemic go away. And so I'm concerned that what may be happening is people are starting to get complacent and maybe less likely to use masks or more likely to get together with people indoors not wearing masks. And I'm worried that people are just tired of the epidemic and hoping that we're past it. And so that's why we need to encourage everyone to really take this seriously. We're going to have, there's more in front of us.
No tenemos claro por qué ha habido este incremento, pero pensamos que tal vez los esfuerzos de vacunación todavía no han surtido el efecto deseado, no hemos vacunado a suficientes personas. Y sí, es preocupante para nosotros el ver que la gente tal vez está tomando una actitud un tanto complaciente, no está utilizando sus mascarillas a tiempo, está teniendo reuniones que no debieran tener. Sencillamente, mucha gente está cansada de la pandemia y tal vez piensan que estamos más allá del peligro. Por lo tanto, nosotros necesitamos alentarlos a que recuerden de que tienen que cuidarse de sí mismos y sus vecinos, observando el distanciamiento social, utilizando las mascarillas y cuidándose. Gracias.
Muchas gracias, Armando. Gracias.
Thank you, Yaima. Just a quick time check. We have only about 15 minutes left and 7 reporters with their hands raised. We will get to all of you, but not beyond that. So we'll be wrapping up Maggie Kent of 6ABC. But for now, let's go to Alan Yu of WHYY.
Hi, I have just one question for Dr. Farley. Can you talk about how the city plans to distribute the however many doses of the Johnson & Johnson vaccine that it expects to get among the various vaccine providers in the city?
So as I said, we're first thinking about what sort of patients or people would be the most important recipients. It would be people who are difficult to get back for a second dose. So that could be people who are homebound or have limited mobility or transient. We're going to be giving the vaccine to providers. We don't give it to patients, we give it to providers. So we'll be giving it to hospitals and we're giving it to community providers who feel that they can reach those populations.
Okay.
Alan, did you have anything else?
I guess a quick follow-up. So it's hospitals, and how do you decide which of the vaccine providers are best able to reach those patients?
Well, we're in discussions with all of these providers on a regular basis, and we're asking them, well, do you think that you can get out and reach homebound people or people with limited mobility? And if so, how many do you think you can reach? And it's through those conversations that we will allocate this. Now, we hope in a month that we'll have many more doses of this vaccine, and we won't have to be quite so careful in the way that we distribute it. But it's right now, it's through those conversations about how many people they think they can reach in those categories.
Okay, thank you.
Thank you, Alan. Let's go to Johan Calhoun of Chalkbeat.
Thank you. First, congratulations to both of you on the progress. First question is for Dr. Farley. Can you give us numbers? You gave us numbers citywide. Is there a racial breakdown of teachers who have been vaccinated?
I don't have that information, no.
Okay, next 2 questions are for the mayor. I've touched on this before many times, but it's still unclear whether all teachers that are scheduled to return will come back tomorrow. Can you give your word that teachers will not be punished if they don't show up to work tomorrow?
Well, first of all, the school district is run by the Board of Education and by the superintendent. I heard no interest in quote unquote penalizing anybody. There'll probably be a percentage of teachers who, like most of other groups, will refuse to take the vaccine or may find some hesitancy in coming back to school. They're represented by a union for the most part. I think all of them are, and I'm sure there's a process that they can work through relative to their status and when they would be coming back. So I'm not in a position to promise anything. Everything I've heard from the superintendent and from the board is there's no desire to be punitive.
Okay, last question. What is your personal message to any teacher out there still hesitant about returning to school tomorrow over safety concerns?
Your union is comfortable and confident that the schools we are opening tomorrow and then for children on Monday are safe and you're able to go back. So I would urge them to go back, get the vaccine. We're making special arrangements for teachers because they do a special job with our children, and I would go to work.
Thank you.
Thank you, Johan. Let's go to Laura McChrystal of the Inquirer.
Hey, Dr. Farley, you had mentioned during your Friday briefing that, the concern was becoming more about the speed of distribution more so than the doses that are available. Can you just say, does that concern carry into this week? And, if so, what is the city trying to do to expand that?
Yeah, so we're still in the situation where we have the problem is more on how quickly we can deliver vaccine than on how many doses we have. And so we're working to try to get existing providers to vaccinate more, and that's hospitals, clinics, and community providers, and also have more providers. So that includes more pharmacies. So you hear about the number of pharmacies we're enrolling. And then we have providers we hope to bring on board through our request for proposal process. All that's working, it's moving. We are increasing the number of doses we deliver each week, but it doesn't go as fast as we like it to go. We'd like it to go even faster still. I'm very pleased with the having the federal site here. That'll greatly increase our number of people we vaccinate per week. It's going to be a big help.
Do you think that there is like a top level of vaccines that can go out in a day or a week that the city will hit, like a ceiling just based on staff and space and providers?
We try to do some estimates. You'll see in the plan tomorrow that I think that if we're talking about in time horizon of a couple of months, we could get over 100,000 doses delivered per week.
Okay. And lastly, as the stadiums prepare to welcome fans back, is there anything the city is doing to try to get stadium workers vaccinated faster? For example, like janitorial and maintenance staff, they seem to be in group 1C, so they wouldn't yet be eligible. Has there been any thought given to that?
We haven't got into that yet, no.
Thanks.
All right, thank you, Laura. Let's go to Jack Tomzik of the Metro.
Thanks. This is for Dr. Farley. Some questions about the vaccine interest database. So how are people selected from there? I mean, say there's two people who, are 65 and have a certain medical condition. Is it first come, first serve? How does that go?
So, well, first we look at people who are eligible based upon their age and medical condition. Okay, and so that's larger than the number of people who we can invite for any particular clinic day. And then we are oversampling people who are in the zip codes who have less vaccinations now. And then setting for each given time, setting a number of total that we're going to pull. And then it's a random sample from there so that people, anyone in the database has a chance of getting selected. And the chance is going to be greater if they're under vaccinated zip code, but otherwise it's going to be random.
And what are those under vaccinated zip codes?
There's a map on our website that shows them.
Okay. And one last question. Do you have any idea of how many people have been invited through the vaccine interest database to get a vaccine so far?
You mean total across all the different invitations?
How about just for the convention center? Why don't we do that?
So for the Wednesday, Thursday, Friday this week, we sent out invitations to 24,000 people.
Okay. All right. Thanks.
Okay, thank you, Jack. Let's go to Lauren Make of NBC 10.
Hi, all. Good afternoon. Dr. Farley, you and Mayor Kenny have both talked about the issue with people forwarding the links that they have gotten. Could you quantify for us for the convention center site, the new site, how big of a problem was this? How many people, how many appointments did you have to cancel because people were signing up who were really not eligible?
Yesterday, we had, it was a relatively small day. We planned to do, small for that convention center, planned to do roughly 800 people. Those links apparently got forwarded very early and quickly. And so we had a big problem. We had a number of people we had to cancel. Still some people came in. So it was a big problem yesterday. I understand today was much less of a problem.
Can you quantify how many yesterday?
I don't have any hard numbers on
was it over 100?
Certainly more than 100 people inappropriately did schedule, and we had to cancel many of those appointments. I don't know how many people still end up getting in who were not appropriate. Today, I have no numbers for today, but my sense is it's less of a problem today.
Okay. The CDC has, the head of the CDC has been warning about cities, states loosening restrictions at a time when Philadelphia is loosening restrictions. Did that warning give you pause at all? And have you had any conversations with representatives from the CDC?
Well, our staff talk to the people at CDC all the time. It's a very close relationship. And we're certainly aware of the CDC's warnings. And there is definitely reason for us to be concerned. But let's remember that Philadelphia has had much tighter restrictions than the rest of the country up to this point. And I think that was the right decision through the winter. And so our looser restrictions are still tighter than much of the rest of the country. I understand there are parts of the country where there are dropping their mask mandates. They're saying you don't need to wear a mask. And that would be a huge mistake. We would never do that. But we think that the careful scale backs we've done so far, we're hopeful that that will not cause a problem. If we have any evidence that it does, and we're concerned about that, we can reimpose those restrictions.
Last thing, actually, let me circle back to something else following up on the links. So beyond just fixing the link issue so that either it can't be forwarded or is only a one-time use or something like that, is there anything else that you are working on to prevent people from signing up if they are not eligible?
Well, people can sign up into our database no matter what.
No, for signing up for an appointment. How do you prevent people from signing up for an appointment if they're not eligible?
Well, that my understanding is the fix that we're trying to get from the software company is that only an invited person can schedule an appointment.
And they would have to identify themselves?
Yes, they come from our database. And so, yes, if people completely lie and falsify their information in our database, they may get inappropriately invited. I hope people won't do that. But the software fix should be so that only people who are invited from our database then can schedule an appointment.
Thank you.
All right. Thank you, Lauren. Let's go to Natasha Brown of CBS 3.
Hi, good afternoon. This is a question for Dr. Farley, just in reference to the sports venues and the restrictions there. Dr. Farley, I think you said that they are effective immediately. If you can just expand a little bit more on that, I guess this is in alignment with the state's guidelines at this point. So effective immediately meaning somebody can go to a game tonight or tomorrow? What happens there?
I think you're going to need to talk to the sports team to find out what their schedule is. My understanding is that, well, certainly opening day for the baseball stadium is not for a month, not till the 1st of April. But I don't know what's happening at the Wells Fargo Center. I think that they may have a game in a week or two and then a gap after that, but you'll have to talk to them about the schedule.
And I think internally they're deciding who to invite based on their season ticket holders. I don't know what the criteria is. We gave them the number and they'd have to determine how people would be eligible.
And the number is 15% occupancy?
Correct.
Okay. And are you concerned at all, Dr. Farley, just about once that does happen and these venues are open for fans, are you concerned about the spread in venues like that, or what will happen, or what do your thoughts about that?
Sure, I'm concerned about the spread in the community as a whole. That's something that's my job is to be concerned. I can say that there are some very careful protocols in those venues. Everybody's going to be told in advance what they need to do. People need to follow that, and the venues assure me they're going to be enforcing those rules. And if they can do that, they can make them as safe as possible.
Okay, and one last question, Dr. Farley. This is just about the Johnson & Johnson vaccines. We were on a call earlier with the state health department, and lots of questions being asked to them about whether the Johnson & Johnson vaccine would be more designated toward teachers, because they're trying to get teachers back in the classrooms and schools open as quickly as possible. Is that something that Philadelphia would be looking at doing with the Johnson & Johnson vaccine?
That doesn't make sense to us. We already have a plan for teachers, which I think is a good plan. It's working quite well. And what's different about this vaccine is that it's given 1 dose rather than 2. We do know there's a lot of people who are very difficult to reach. As I said, people who are homebound, people with limited mobility. They can't go to the convention center or big clinic. So it makes a lot more sense to me if we have a limited number of the doses of this vaccine to reserve it for those hard to reach people. Now, in the future, a month from now, if we have lots of this vaccine, then we may want to open up and use it for any population. But right now, that allocation scheme makes more sense.
All right. Thank you, Natasha. Let's go to Maggie Kent of 6ABC.
Hi, thank you for taking my question. I have two. The first one is, we heard something about the CDC vaccinating people in the city within apartment buildings as congregate settings. Do you have any information about that?
The CDC vaccinating people in
congregate settings as in apartment buildings? Are you guys working on vaccinating people within apartment buildings?
Yeah, so that we have been vaccinating people first in nursing homes, personal care homes, so assisted living facilities. And increasingly, there are various providers that may be going to what you might call senior housing, places where there's a number of seniors that are in a housing facility. We're not even aware of all those because those providers can set up those arrangements on their own.
And those providers could be something like a pharmacy or a doctor's office?
Could be a pharmacy, could be a clinic, could be a hospital.
Okay. My second question is about the Johnson & Johnson vaccine as well. As you mentioned, it would be a good tool to use for a population such as the homeless population. Has there been any coordination with the Department of Homeless Services, homeless outreach at all to get that word out to that population, or to have some kind of program to get the homeless population vaccinated with Johnson & Johnson?
Yeah, the vaccine was just approved over the weekend, and we just put our allocation in today. We deal with the Office of Homeless Services all the time. They're part of my cluster in city government. So we don't have a plan yet, but we'll be working on it.
Thank you both.
All right. I want to squeeze in one last question. Max Marin of Billy Penn was having technical problems. So Max, are you able to unmute?
Yeah, can you hear me?
Yeah, go ahead.
Great, thanks for squeezing me in. Just one question for Dr. Farley. The Black Doctors COVID-19 Consortium is using some sort of criteria to determine which zip codes are the hardest hit and most in need of the vaccine. Is the health department working with vaccine distributors to determine which zip codes meet that criteria?
We have communicated to Black Doctors specifically, and probably all the other providers as well, which are the zip codes that have people are under vaccinated.
Okay, and what criteria are you using to determine that?
Well, the map is on our website. We put zip codes into 3 tertiles, if you know what I mean. So third, low vaccinated, medium vaccinated, and high vaccinated. And we want to have more invitations and people in the low vaccinated zip codes.
Okay, that makes sense. Thanks.
Good, Max?
Thanks, Mike.
Very good. All right. And with that, we will wrap up today's press conference. I believe the health department will be holding one again on Friday. Details on that to come. And then we will join you back again here next Tuesday, March 9th. Thank you.